Hi, my name is Heather Beavers. I'm a nurse practitioner student at Texas State University, and today I'll be doing a focused physical examination on my patient who comes in with abdominal pain in the left upper quadrant. At this point, we already did his health history with review of systems, his vital signs, his height and weight, and BMI. So we're going to go ahead and get started. First thing I'm going to look at is his general demeanor. I'm going to be looking at his skin, texture, his eye sockets to see if they're sunken, any signs of malnutrition. I'm going to go ahead and take my pen light here and look at the color of his eyes to see if there's any indication of jaundice. And while I'm doing this, I also see that his pupils are reactive to light equally and bilaterally. His eyes are pretty clear and white, no blood vessels seen. We're going to go ahead and move to his mouth. I'm going to have him open his mouth, and I'll be looking at his hard palate, which is a light pink or wider pink, and his soft palate is pink. His uvula is midline. If you could say "ah" for me. Ah. It rises midline with his tonsils about a 1+ bilaterally. If you could stick out your tongue for me. Sticks out midline. There's no fasciculations at all. Okay, you could go ahead and stick it back in. Okay. He has good dentition, no missing teeth. Gums are pink. No evidence of lesions or masses or bleeding. I'm going to have you push your tongue against my hands. Good. Good strength there. Very good. Before I move on to the neck, I'm going to go ahead and feel for his temporal mandibular joint. So if you could go ahead and open and close your mouth. Okay, I do feel a click, which sometimes is a normal finding, but we're going to go ahead and feel his lymph nodes now. We're going to start with the preauricular, postauricular, then we're going to go to the occipital, his tonsillar, submandibular, submental, there we go. We're going to go to the anterior cervical, post-cervical, and then we're going to feel that deep cervical. And we're going to see if there's any swelling or tenderness, any pain. Have you noticed any swelling or tenderness? Okay. Now we're going to move on to the neck. I'm going to look to see if his trachea is midline, which it is. I'm going to go ahead and feel his carotid pulse while I'm here. Okay. There's no thrills. I'm going to go ahead and take a listen. There's no bruise. Next, I'm going to move on to the thyroid cartilage. I'm going to have you go ahead and take a swallow for me. And you could kind of feel it moving underneath your fingers. I'm going to displace it and feel the nodes. It should be soft and non-tender, which it is. Actually, while I'm here, I'm going to have you swallow again. All right, very good. And it moves underneath my fingers. One more time. All right, very good. Next, we're going to move on to the chest. You okay? Mm-hmm. Okay. I want to be looking at how he's breathing, if there's any signs of dyspnea, or if he's showing signs of accessory muscle use or labor breathing, which he's not. It looks pretty relaxed and even. Before I take a listen, though, I'm going to go ahead and feel his skin turgor, which is a good indication of skin hydration, or hydration, sorry. Good skin turgor. I'm sorry. I'm going to go ahead and palpate for any crepitus, any masses, any tenderness. No. All right, very good. Now I'm going to take a listen. All right, very good. going to go ahead and take a listen to the sides here. Very good. I'm going to listen to this side. One more time. I lied. It's actually going to be 2 more times. One more time. Alright. Very good. So he has, there's no evidence of wheezing, bronchi, crackles. He has very clear lung sounds, no evidence of diminishing. So I'm going to have him turn around to where his back is facing the camera. And again, we're going to be looking at the appearance of his chest or back, if there's any evidence of accessory muscle use, if it looks like he's unlabored, or I'm sorry, labored breathing, which he is not. I'm going to go ahead and feel for any crepitus or any lesions or masses, which he does not have. I'm going to go ahead and look at his thoracic expansion. Go ahead and take a deep breath. And it's equal. Also, his transverse diameter is less than his AP diameter, which is expected. Next, I'm going to go ahead and feel for his costal vertebral angle tenderness, just to make sure there's no kidney involvement. Usually you'll feel some pain when we palpate there. So just let me know if you feel any pain, okay? Any pain?
No.
All right, we're going to do it one more time. Any pain?
No.
All right, very good. So I'm going to go ahead and take a listen. All right, very good. Also, I'm going to go ahead and percuss the area. What I just heard, sorry, I'm jumping forward. His breath sounds were clear, no diminishing, no signs or audible evidence of wheezing or crackles or bronchi. So I'm going to go ahead and percuss. And over the lung fields, you should hear a resonant sound, which I do hear. All right, so now I'm going to have him go ahead and lay down. Thank you. And we're going to go ahead and move to his cardiac. So we're going to be looking at the point of maximal impulse, or the apical impulse, which you should see in the mid-clavicular line around the 5th intercostal space, which I do see. I'm going to go ahead and palpate there. All right, very good. And I also don't see any evidence of any heaves or thrills. I'm going to go ahead and auscultate for about 1 minute, but I'm going to cut it short for the sake of the video. All right. So he has a regular rate and rhythm. I heard S1, S2, no extra heart sounds like S3 or S4 or any murmurs. Very regular rate and rhythm. I would say his rate is an 80. So we're going to go ahead and move on to hearing his other heart sounds. We're going to start off with the aortic area. And then the pulmonic. We're going to move to Erb's point. Tricuspid. And then the mitral. Now we're going to do the same thing, but with the bell of the stethoscope. So aortic. pulmonic, Erb's point, tricuspid, and then the mitral. Alright. So no extra or abnormal heart sounds heard. S1 and S2 heard in all areas. We're going to go ahead and move to his abdomen. We're going to be looking at the contour and the color, noticing any evidence of pulsations or especially around the umbilical region. I don't see any pulsations or heaves. Now we're going to go ahead and have you raise your head. I'm going to be looking at his face for any grimacing or guarding. Alright? And I don't see any evidence of any bulging. Alright, go ahead and lay down. The first thing I'm going to go ahead and do is auscultate. We're going to listen to all 4 quadrants of his bowels. Okay. I do hear some hyperactive vowel sounds with some high-pitched tinkering. We're going to go ahead and listen to the vascular in his abdomen. We're going to start off with the aortic. Okay, we're going to do the renal. And then the iliac. All right, very good. So now I'm going to go ahead and percuss his abdomen. Typical finding is tympany over the abdomen area. Okay, there's tympany in all 4 quadrants. We're going to go ahead and move on to palpation. We're going to start with light palpation. Now earlier he did say that he had left upper quadrant pain, so we're going to wait for the last bit to palpate the area just for the comfort of the patient. And you just let me know if you feel any pain, okay? Any tenderness?
No.
Okay. We're at the left upper quadrant. Any pain?
No.
Okay. We're going to move to deep palpation now. Any pain?
No.
Alright. So now I want to see if there's any spleen or liver enlargement. So first I'm going to feel his spleen. I'm going to put my other hand behind his back here, and we're going to go ahead and palpate to see if we can feel that edge there. Alright, and I do not feel any enlargement. So next we're going to move on to the liver. Now what I'm going to have you do is go ahead and take a deep breath in, and I'm going to see if I can feel that edge there, okay? Very good. And I do not feel it, which can be a normal finding, but what's most important is that there's no enlargement in that area. So if you could go ahead and take a sit up. And that concludes our focused physical examination. Thank you.